Hi, this is Eric Stoller for the Eric Stoller Show and the Patient Zero series. We're here at Gentera Center for Precision Medicine. I'm here with Dr. Adonis, the Director of Precision and Regenerative Medicine. Thank you for having us here today. Thank you for the opportunity to get a chance to interview you. So, Dr. Adonis, tell me a little bit about your role here at Gentera.
Absolutely. Nice meeting you. Thank you.
Thank you.
I do function on the Director of Functional and Regenerative Medicine at Gentera Center. And we look for the root cause of the problem. So if somebody wants to, we have very advanced laboratory and diagnostic testing. So we go down very deep to identify the metabolic and the biochemical, genetic, hormonal root causes of the problem. But even if the person feels great, is healthy, we try to kind of look for what's in balance and they don't know. So we balance them all with different tools that we have so they can have the most effective and the most best way of aging.
So you talk about optimizing their health. And, as today, many people are used to, you go to the doctor and they give you, try this pill or try this pill. But we're not trying to just manage disease. We're trying to find, as you said, what's the causes of these disease, lifestyle, and other. So when somebody comes in here for a treatment, I'm sure you have a lot of people that, like you said, they're healthy, but there may be things underlying.
Yeah, absolutely. Some people, they want to stay up in the game, like competitive world. People start aging after 35, 40, 45. And brain function is a big one. And they want to stay productive. They want to stay focused, or sexual life, or the normal aging process in women, like menopause or andropause in men. And mostly we're talking about healthy people.
Yeah, sure.
We haven't even talked about autoimmune disease. There is an epidemic of autoimmune disease, neurodegenerative or brain degenerative diseases. So we go for those very deep and very sophisticated testing, so identify those metabolic and biochemical root causes of the problem, as opposed to conventional medicine that just treats the symptom.
Right.
So if you have high blood pressure, we give you high blood pressure medication. If you have chest pain, or we give you chest pain medication.
Right.
Or diabetes medication. We go deeper to why do you have diabetes? Why do you have high blood pressure? Which is not only lifestyle, it's genetics, it's whatever you were doing when you were a child that you have no control of because it was your parents.
Sure, right.
So we try to reverse all of that metabolically. The secret is to go deep metabolically.
So go deep metabolically. And so share with me, if somebody's a new patient coming in, because I know you run them through a series of diagnostic, tell me what that experience might be like if somebody was to come in for an initial visit.
Definitely. We have a very lengthy consultation, sometimes an hour and a half.
Okay.
Very lengthy questionnaire, because we want to go back in their lives, back into their genetics. What were they doing when they were a baby, when they were young, how much antibiotic they got, how many surgeries, how many places they moved. People who have lived in as many countries, the more countries you have lived, the more chances you have of having chronic diseases.
Interesting.
Toxic exposure, stress, changes. So we have a very lengthy conversation on how they feel. And then we do very deep blood tests. We do MRI or full body MRI. We do X-rays depending on the ultrasounds, carotid ultrasounds, the blood test, urine test, sometimes hair test, to kind of identify all of those areas that are in balance. And then we create a very personalized, sometimes 2-3 pages program, and we help them implement that. It's very, very personalized, very unique. So that program could be vitamins, IV vitamins, and regenerative therapies, HRT, hormone replacement therapy, detoxification, and brain stimulation. So there's many topics or areas that we address at the same time. And of course, we help them with lifestyle, nutrition, exercise.
So you're talking about a total holistic approach, looking at the individual, looking at everything from where they live, which is amazing, because who would think about that, right? Mm-hmm. But you're right. I think about it when I was in college. I went to London for 6 months, and one day we're sitting in a restaurant. My friend says, "Look at this," and he blows his nose. You didn't realize how much pollution was in London that came out. So who knows? That
Yeah.
was many, many years ago.
Imagine living there for 5 years.
That's right.
It stays in your lungs, or working on a minefield for in mine for many, many years. It stays in your
Stays
body.
in your body.
So we help identify that. Sometimes they are depressed and all they have is a nutrient deficiency because they got the gene. It's interesting, genetic. It's amazing. It goes, generations. People who were their grandparents were exposed to something, it can show up 3 generations later.
That's amazing. So let's talk. I know we talked a little about some of the treatments, but I want to ask you, personally, what attracted you to get into this field of medicine? What brought you to get into this, which is today, as years ago was like, oh, this is taboo. Today, anybody who's serious about not only living longer, but living longer and healthy and being productive are going to see folks like yourself, Dr. Adonis. Isn't that true?
Absolutely. I'm a brain surgeon by training. And we did brain surgery and spine surgery. But then I started to see that, I could only help people a certain way. And then I said, I started being interested in trying to help from the inside out, especially the brain function that is so important. So I got to know anti-aging medicine, functional medicine, and it was like going back to medical school again. Because we learn, all physicians know this, of what we do, but they don't apply it.
Right.
Because when you leave medical school, you go to practice, it's all about medications, procedures. They're good doctors, but they have 7 minutes to talk to a patient because of the pressure of reimbursement insurance. And then they don't have time to create a 3 pages program. It's easier, and they do it unconsciously, to give somebody a prescription.
Script, right. And it's so true, because I know I've had a heart condition for many years, and at one point my doctor said to me, he goes, try this. He goes, well, what should I? He goes, well, if you get a reaction, if you got a headache or something, then we'll change it to something else. I said, that's it? So there is no precision when it comes to a lot of these medications, where when, and people have to know this, I'm a product of that, doing all those things. I've lost like 50 pounds in the last 6 months using, a trizipatide. But I say this because it's helped me just gain a lot of my health and my self back. So if somebody is really like sitting there, they're like, should I come in? I don't know if this is for me. Maybe they think, oh my God, it's going to cost me so much money. And let me just address people. If you have a heart attack and die, then what does it matter? I was lucky. I had a heart attack at 46, and I had to take my wife for an emergency surgery. And that's when they ran me in and said, let's take you upstairs. And I had full blockage.
Wow.
So my wife saved my life when she was going for her, when she had to come in. But how many times that it happens that somebody that was healthy or thought they were healthy has something like that they never address?
Especially stress. Stress is big. And then we have a lot of very successful go people. Stress, yes, people are successful. They go up in life, but then their health, it crumbles because it's too much stress. So we tell, we personalize everything. It depends on the depth of the program, which is the cost of the program. We try to help everybody, but it's mostly what they want to do with their health. Beyond cost, and it's important, but we help them kind of organize their lives. It's 60% lifestyle, 60%, and then that doesn't cost anything.
Right.
So we help people, we educate people. We spend a lot of time talking to them, educating them. Sometimes all they do is a consultation. Yes, it's a long consultation, very in depth, but they don't have to buy,
of course,
very expensive programs. It's lifestyle, it's